Hello, everyone. Good morning, good evening, good afternoon, wherever you are. Welcome to this session. I see a lot of people are still joining. Maybe we'll wait for another minute or so before we get started. All right, perhaps we can get started. My name is Sana, and I'm a public health researcher and practitioner based out of India. I'm also part of the sub-team that has coordinated the multimedia track for this symposium, the others being Clara Busamra, Kenneth Munge, and Leanne Brady, who's also presenting today. Multimedia has been part of this symposium since 2014, and we are quite thrilled to see how it's evolved over the years. This year, we have 4 multimedia panels, of which this is the first, and we are especially excited because the theme of this year's symposium is Reimagining Health Systems for Better Health and Social Justice. And this inherently demands a paradigm shift in how we view health systems research, interventions, how they are conceptualized, conducted, and interpreted. And inherent in this, I think, is the need to engage with our various stages, whether it is in designing interventions, understanding health problems themselves, or influencing policy. And in today's session, what we are going to try and do is reflect on the role that multimedia can perhaps play in doing this. Specifically, this organized session is going to discuss the potential of multimedia to surface different sources, channels, and expressions of power in health systems research, and the ways in which these can both be leveraged as well as challenged to promote social justice. Um, in doing so, multimedia can pose important questions, such as what constitutes knowledge or evidence, and how should solutions to ongoing health problems and social justice challenges be imagined. Um, so this panel brings together a diverse range of multimedia practitioners that have sought to fulfill these purposes. I want to quickly go over what the format of this session is going to be like. Um, we will watch 3 pieces of work, which will be introduced by the panelists very shortly, after which we will have a short panel discussion and then a Q&A. Because we know that people may have bandwidth issues, we've also uploaded the 3 pre-recorded presentations on Vimeo, and the link will be posted in the chat box shortly. So in case you have a network problem, you could also watch them there. Although we recommend that you watch them on this platform on full screen, so that you can also watch the introductions by the speakers. If you can please post the link. Yeah, so I will, I think the link has been posted in the chat box. So with that, I'd like to invite our first speaker, Leanne Brady, who is a PhD candidate at the Health Policy and Systems Division, University of Cape Town. Her film, which is going to be screened, is called Unjust City, Journeys Through Cape Town's Health Systems. Leanne, can you say a few words about your film, and then we can move on to watching it?
Hi everybody, and thanks, Anna, for that introduction. Yes, this is a short film, 10 minutes long, and it's 3 interwoven stories told by 2 community activists, Roshanda Pascoe, who's an activist from Manenberg, currently part in a witness protection program, Mark Nicholson from Lavender Hill, also in Cape Town, who's been doing a lot of work to develop alternatives for kids in Lavender Hill, and then an ambulance crew, Lauren and Zane, part of the department that I work of. And the goal of the film is through these 3 interwoven stories to take you on a journey, both historical and political, through Cape Town's health system. So hopefully it will be a great catalyst to some conversations, and I hope you enjoy it. Thanks so much.
What's happening now is in fact a volcano erupting of the crime and violence that has been created through generations. It comes a long journey from colonialism to apartheid up to now. Our men and women in uniform, like your EMS, police, nurses, doctors, are on the front line on a daily basis. They're not only treating the wounds that they have to heal.
We had 21 calls last night. Stab, chest, stab, neck. Most of our calls were assaults. But please, if you're not going to phone an ambulance later, please go to the doctor or the clinic tomorrow. Take care. Thank you very much. Where you live says a lot. Like this is a sewage drain. And it makes you sick. Reference number 2199. Call back, please.
Okay, we'll call back.
We have the locations where we have shacks and things. We have the upper class areas as well.
But that's mostly for suicides and overdoses and stuff like that.
Yeah.
Now, Karaja, can we stand down here on this one and move to the next?
Okay, 01, where are you in this world?
Good evening. We've hooked up with law enforcement, so we are heading towards the call. There is no way that you can go in without any law enforcement or SAPS or anything like that. And here they are, coming out. The military is in the area for safety purposes. It's all about scene safety and community safety and obviously our safety. There's a few people saying positive things and there's a lot of negativity. Like I said, it all remains to be seen at the end of the day.
We have a traumatized health system that have to give service to a traumatized community and society. Hanover Park Day Hospital is barbed wired, closed down. The hospital resembles a prison. Is that the face of the hospital? I've never thought 45 would be the age for me. I've always said this, by the age of 30, I would be dead at the way things go. And I think I was about 15 when I echoed that words into the universe. I went to testifying in court against a prominent gang leader. They shot at my house in Mandenburg. When the journalists came and looked at the house and the cartridges, they were like, nobody got hurt. And I said to them, the fridge and the stove and the plates and the cups are all dead. Where's my socks? That's nie my kous en die tekkies. In this witness protection process, this is our third place that we are living in. I try to keep it as normal as possible. My daughter are not able to attend school. The schools are a bit afraid to take my daughter on. We are in limbo because why? Being an activist doesn't pay a salary. You do it out of the good will of your heart. So, besides all of that, your bread and butter issues, where you don't have at times food to eat, where you go out of electricity, there is no data. You're practically living on the wing of an angel every day of your life. My grandfather said, no matter if you had to die for the truth, then you have to die for the truth. I think the big question on many people's minds is, why would a woman do this much, putting herself in danger, knowing what lies ahead? It does not stop the work from going on.
We all feel that we are in captivity in our own homes. Levendale is a very nice place. It's just been changing around due to the fact that gang violence and too many guns has come into the hands of all the wrong people. When I heard that the army will be deployed into the different communities, I actually had mixed feelings because what if the soldiers decide to start shooting on a guy with a machine gun and the guy maybe shoots back at them? It's easy for somebody, say for instance, that says in Table View or says in Constantia to say, yeah, but the army this and the army that. But if you stay within the area and see day-to-day murders and children being killed and guys running with guns, then you would know what it is really like, how the happiness comes into people's hearts that the army is actually within the areas affected by gang violence. That's my backyard there, where the guys are sitting. We set up this place to allow the children to have a safe space to play in and to come to.
If the shooting is out there, we are safe here and our parents know we are. We are a team that is building the team more bigger.
I think the reason why they've actually dumped everybody in these different spaces, just with the group areas, is just so that we can just start deteriorating, because why we won't be dependent on ourselves, but we will have to depend on somebody else. But in the end, we have to deal with it. You know, we have to rise above our circumstances. So eventually, everything comes to an end. You know, the shooting will also come to an end. If it stops in the next 2 months, these kids will then forget that it ever happened until it happens again.
My daughter is crazy about unicorns.
Thank you, Leanne. That was a really beautiful film. Quite a nice example of how film can perhaps represent the realities in which our health systems are located in a very different way than writing can. Thanks for that. So we'll move on to our next presenter, Meena. Meena is a PhD scholar at Maastricht University in the Netherlands, and her presentation is called Talking Images. She will talk about rich pictures as a tool in a complex health system strengthening intervention, which was implemented in India. Meena, can you say a few words about your presentation before we start watching it?
Thank you, Sana. That was a nice introduction. In this session, I'm going to talk about how we used rich pictures, which is a participatory visual tool, which evolved from soft systems methodology, was used in a complex health system strengthening intervention called Basic Healthcare Support Program in 2 states in India. So this program is implemented since 2004, more than 15 years. And the tool was actually introduced in 2013 during an external evaluation of this program. So since then on, the rich pictures became part and parcel of this program. So this is a very nice example to show how we can produce knowledge locally and also utilize this local knowledge in the planning and implementation of a health system strengthening intervention. I hope it will be useful to you. Enjoy the session. Hello everyone, I'm Meena Putturaj from India. So I'm going to demonstrate how we can use rich pictures as a tool in a complex health system strengthening intervention. So the intervention is called the Basic Healthcare Support Program, which was implemented in 2 states in India since 2004, and it is still ongoing. The guiding framework for health system strengthening is primary health care. So it's mainly a local health system strengthening project where you strengthen the governance processes, and the main principles are linking of practice, comprehensive approach, learning by doing, and also to empower the communities. And the cross-cutting principle is people-centeredness. So in this health system strengthening intervention, we have something called district health forums in the 5 districts. So each district health forum has a different model, has a different composition. For instance, in one district called Darjeeling, we have a people's health forum where people, the communities also play a role in the health forum. But whereas in Howrah district health forum, you have only the grassroots NGOs. So basically like this, we have 5 different models, and they are interlinked by a national level NGO called the West Bengal Volunteer Health Association, and they have linkages with an international Belgian-based NGO called the MEMISAM. And these district health forums, they work very closely with different community groups as well as the government institutions. Like for instance, the geriatric groups, the women's self-help groups, the adolescent groups that are at the grassroots level. And they also work beyond health sector because their focus is primary health care. So they work with local government institutions, village health sanitation and nutrition committees, and also local health institutions like the primary health center, health sub-center, child nutrition centers, etc. Now, what are rich pictures? So rich pictures are basically the simple drawings which are developed by the health forum members and these community groups as well as the government members of the government institutions. So they are simple drawings that convey rich meaning. In a way, these rich pictures become a way of living through these basic healthcare support program for the different stakeholders, a way of doing things, learning and reflecting. Now the process, people come together, deliberate, discuss and put their ideas on the paper, and then they share their drawings and pictures with the larger group, and they deliberate and arrive at a consensus. So I'm going to give you a sample of pictures. So this is one picture which is drawn by the national level NGO coordinators. So here they have given an analogy, like before the basic healthcare support program, before the inception of the district health forums, the public services in those districts, were very poor. It is kind of derailed with no proper information. People were actually not utilizing the services. But later, because of the advocacy and various other strategies adopted by the district health forums, the different institutions at the local level, they started coordinating with each other, and people have also utilized the services in some communities where this program district forum members are working. And the other picture developed by geriatric groups of the basic healthcare support programs. Here they try to express the changes they experienced within the program. For instance, they are able to participate in the spiritual activities. They're able to participate in the social life. So they want to share how the healthcare services were streamlined because of the advocacy with the policymakers at the district level, sub-district level. So this is what they're trying to show in this picture. And the other picture here, they show how in this program, how the advocacy of the district health forums, because of that, they were able to renovate a health sub-center, which was in very poor condition earlier, and how they were able to rebuild this. So it's a 7-year struggle. So they want to show that in this picture. Now, what the different stakeholders who developed rich pictures say, what is their experience? So they say that these pictures help to stimulate to think how aspect of their problem or the solution, and it is a monitoring tool for them. And also they say sometimes new ideas pop up during the rich picture development process, and even those who are not able to read and write, even they are able to express their ideas fully through these pictures. And they say this pictures allow them to see one situation in many ways during the development and also the deliberation processes. And one person said it's like a mirror of mind, and it also enables group interaction and learning. So I showed the earlier picture how they are able to cut short a big story into just few pictures. It helps in that. But it is not without challenges. Documentation is important because if you see the picture again after many years, it could convey a different meaning. The meaning lies in the eyes of the beholder. So one picture could convey different meanings, so documentation is important. And since it is a team effort, whose ideas goes into the picture is an challenges. So arriving at a consensus, there is some power dynamics that is going on within the group. So to address this, we had facilitation and also training, and with repeated usage, they were able to overcome this power unjust power relations through the rich picture development process. And we also faced ethical challenge. Once a person reported elderly abuse, and that became a big issue, and the program people as well as the forum members had to confront with the family member of the elderly who reported the abuse. So we had to negotiate and compromise, come to a compromise. Such things happen. So now the key takeaways are, we learned that these rich pictures helps us in unpacking the complexity that is there in the health system strengthening intervention, and it is a kind of alternative evidence that can be used in the processes of health system strengthening intervention, like what we have done, what we got to do in future, how to reformulate the program strategies and all that. And most importantly, it cultivates the value of co-creation of knowledge, co-creation of evidence, and most importantly, it helps to redress the injustice that is happening due to the power of certain kind of knowledge systems and certain kind of factors in the health system strengthening intervention. Thank you very much. Happy to take any questions.
Thank you, Meena. A really nice example, and there's already also a question about more references for using rich pictures, but we'll come back to that later on. Next up is Matthew Griffiths. Matthew is a multimedia creative director, also from South Africa, and his film is an animation. Matthew, can you speak a little bit about your film before we screen it?
Hi there. Yeah, so I thought I'd just give a bit of an introduction to how this video came about. I'm not a health professional, I work in media, and the majority of my work though is around science communication. I come from a family of scientists, and I found my way back towards science and now work with a lot of NGOs and other organizations to help explain their research. I have a few friends and a partner who are involved in public health, and I find myself hearing a lot of criticism around our proposed national health insurance, our NHI, a lot of that in the media. And I raised with them, and we realized that there was a lack of positive messaging around what the NHI could potentially be, and what was needed to get it there. So I offered up my skills to them as a creative director and an animator, and asked them if they could come up with a script and a message to challenge viewpoints and perhaps be used as a leverage for change. So a writing team was formed, and together we came up with this idea of looking back at the NHI from the future and how it came to be after many attempts, how it could work positively for all the people and not become this corrupt, poorly funded system that many foresee it as. So we created this video hoping that it could be used in community engagements to start discussions around the NHI, get the public to ask the right sorts of questions at these public hearings. But unfortunately, with COVID-19 happening, these engagements didn't actually come about. And it also means that the video now lacks a section where it says 2020 when the global pandemic struck. But that does really shine a light on the questions which we are raising, the difference between our private and public healthcare systems and the vast inequality there. So I think this means that if we add that new section in, it could become relevant again, as this COVID-19 pandemic has really drawn attention to our healthcare system and those inequalities and the care that the different types of care that South Africans receive. I think the conversation we were trying to start then is now more important than ever as we take stock and look to the future of healthcare in this country. So I hope you enjoy what we made.
Welcome, Wamkilekile and Dumela. You are now on the bullet train from Umtata to Johannesburg. The next station on this line is Stilson. We will be arriving in Johannesburg at 15. Jonga! South Africans fought long and hard for our health system. In 1944, when my mother gave birth to me, at home, alone, no midwife, no antenatal checks, nothing. Back then, we actually came close to real change. Doctors had shown that South Africans were getting sicker because they didn't have access to affordable healthcare. And other countries, like the UK, they were introducing their own national health systems. We could have been one of those countries, but then apartheid happened and it all fell apart. After 1948, black people couldn't even set foot in a white hospital, even if they were dying. Our health system was unequal and unjust for a long time after that. When I went into labor with your mother, I spent an hour in a taxi trying to get to hospital. I passed whites-only hospitals, I passed private hospitals, and I couldn't go in because I didn't have medical aid. When I finally arrived in hospital, there were no beds and I had to give birth right there on the floor. That's why I always teased your mom. She could only go up from there. In 1994, we were free because apartheid had just ended. And we were so excited about the possibility of a fair and equitable society. Madiba had just announced free primary healthcare. But instead, we got massive privatization alongside austerity measures in the public sector. It may be hard to believe now, but back then, we thought it was okay that the healthcare you got depended on how much you could pay. We just didn't think about healthcare as a human right. It's crazy. You were part of the born frees. Born to the free market, that is. When your mom gave birth, we thought we were lucky because we had the money to afford private healthcare. When her contraction started, I wasn't even worried. Ngoba phela uyazi, in medical aid, I was sure she would get the best healthcare the money could buy. But money was the problem. The doctors could make more by doing a C-section, so they did. If they hadn't, maybe your mom might still be alive today. Do you remember? When you were in high school, the government announced a plan for free universal healthcare, the white paper on national health insurance, a revolutionary plan for free, high-quality healthcare for everyone. But South Africa was in a bad place. We were one of the most unequal countries in the world. In rural areas, people still had to walk for hours to get to their nearest clinic, whilst in the cities, the clinics were always full. Healthcare workers hated their jobs because they didn't have the resources to do them well. Private healthcare became more expensive and less accountable every year. Our trust in the state was at an all-time low, and for-profit healthcare companies had become powerful and profit-hungry. By the time the bill for funding the NHI was up for debate in Parliament in 2019, it was missing many of the key pieces of the original plan. We were at a crossroads, and it really could have gone either way. Even with the new bill, things almost got much worse than they were during apartheid. But yazini Shem, South Africans know how to fight for their rights. In 2019, we were on fire. Shaw Majozi made John Cena famous. The Springboks won the Rugby World Cup, and Banyana Banyana, our girls, made the Soccer World Cup. Mamela man, we even made tampons tax-free. The public realized that the NHI, it would affect us all. Doctors, nurses, sick people, healthy people, policemen, teachers, everyone. So we took to the streets to declare what we wanted. We started a grassroots movement using our constitution to fight for a quality health system owned by the people. We wrote thousands of submissions to Parliament, and we showed up at the NHI public hearings to ask important questions and demand answers. We revolutionized every part of the health system, not just the financing. We fought for ourselves, and we fought for each other, for everyone in South Africa. Who would have imagined that one day we'd have healthcare workers coming directly to our homes, or well-staffed clinics so no one has to wake up at 5 a.m. to queue? Best of all, no one has to worry about paying for the doctor because the NHI, it's funded by our taxes, just like the streetlights or the parks. It's only because we stood up in 2020. When you go into labor next month, the color of your skin, the money in your bank account, even where you're from, that won't determine the clinic you use and the healthcare you get. And you certainly won't get an unnecessary cesarean section that might kill you. I never thought we could get the healthcare system we have today. But we did it because we all got involved. It's our country, and we fought for the healthcare we knew we deserved.
All right. Thanks so much, Matthew. That was a really nice example of, I think, of how fairly complex issues can be not oversimplified, but made so accessible for advocacy and, of course, for people to make sense of what all of this insurance stuff means. I also want to just announce that the Q&A is live. So if you have any questions or comments, please feel free to type them in, and we will try and respond to them as we go along. But we'll also keep a little bit of time towards the end for Q&A. The three panelists, if you can put on your videos, it might just be more easy to have this discussion. Thank you. Yeah. So I wanted to just ask all three of you to reflect a little bit on what using multimedia offered for what it was that you were trying to do, whether it was your research, whether it was the intervention that you presented, Meena, or what seems like an advocacy project, Matthew. But what is it that using multimedia added value, and why, and how did you use this, if you have, or how do you plan to use it in the future if you haven't as yet, beyond just making of the quote unquote product? Leanne, do you want to go first?
Sure. Thanks so much, Sana. So I guess for me, this film is part of a broader body of work that, there we go. Oh, I can see everybody now. That's great. It feels much more interactive as we all try to liven up an online conference. Yeah, for me, this film is part of a broader body of work. I've done a couple of other films about sort of a similar issue in the health system. And before COVID, as Matt also pointed out, a lot more was possible in terms of engagement. And so I guess it's had multiple different purposes, and the value that it created both for me and for colleagues that I have in the health department, I think I can think about in a range of different ways. Maybe first I'll start by talking about my role in the health system is as an embedded researcher. And so I make these films or multimedia products as ways to grapple with some of the very complex issues that our health systems face. So as you said in the beginning, Sana, a film can just bring to life lived experiences from the front line in a way that's quite hard to do in a paper, for example. And I think what we've seen in a range of interventions in the health system is that that's really made a difference to how people think about these health systems. So to give one example, ahead of a national safety symposium in emergency medical services 2 years ago now, we screened 2 of these films with senior leaders from across the country before having a discussion about various very difficult policy issues that needed to be considered as a way to kind of put lived experiences of frontline healthcare workers front and center. For this film, there hasn't been opportunity to do anything with it, but also because of COVID. But with the previous film, we did things like had big screenings in the neighborhoods where these films were made. So a previous film called Red Zone Paramedics was screened in Tafelsig, and it brought together a number of people from Tafelsig, community leaders, as well as ward counselors and paramedics and others from the health department to talk about these issues in a way that hasn't really been possible outside of that. So I think films can act as quite powerful catalysts to starting conversations and maybe shifting narratives and therefore shifting how we think about what solutions are possible. So I think in terms of how we reimagine the forms of research we need to reimagine our health systems, there's quite a lot of potential contributions that multimedia can make. And then maybe just the last quick point is making these films for me means I spend a lot of time riding around in the back of an ambulance or hanging out with really amazing community leaders and learning a lot more about these issues than I would otherwise, I think, and in a way that allows for almost like some sort of co-producing stories together, which has been really, really valuable for me personally. And a lot of those relationships are still very strong and ongoing, and in fact have been very important during the response to the COVID pandemic. So I think, yeah, let me stop there for now, but thanks so much.
Yeah, thanks so much, Leanne. Meena, you also spoke about how rich pictures have been used to help communities themselves engage with what this intervention was in a fairly autonomous way, with like literally a blank slate. But how have these been used outside of the community per se? And according to you, what value did that add to, say, you know, a policy brief or a descriptive sort of writing report of something like this?
Thanks, Sarah, for that question. So to understand what value this rich picture brought into this program, what we implemented in India for more than 15 years, I think we should understand the nature of the program itself. So as I emphasized earlier, it's about people-centeredness. It's about bringing communities, making communities to participate in the governance processes, especially at the subnational levels. So, it is implemented through a network of community-based organizations, more than 40 plus NGOs. So you can imagine the kind of the strong coalition that they have at the grassroots level. So it is in that spirit this tool was introduced into the program, and it definitely added a lot of value because the tool itself, if you see, it enables participation, it enables a dialogue from different stakeholders. That is more important, I think, because we are all dealing with complex problems, and often these problems we cannot define clearly. So that's why we say it's soft natured, because from different perspectives the problems gets defined in a different way. So from that perspective, the tool really helped participatory participation from the stakeholders of the program. So it is their program, so it helped them. Most importantly, it helped in the action reflection process. So it really helped them to reflect on what they have been doing on the ground, what is required, what is how they have to change their strategy. So that it helped in that process, action reflection, and it kind of created it enables that learning cycle, I think, which is more important since we are dealing with complex, wicked social problems, and at one go we cannot have solutions. It's ongoing process, and rich pictures really fit into that. And the other important thing is, as Leanne said, it also enables co-creation. So we know that if you think about health system strengthening or governance, it's a big terms. And who is powerful? Is it the words of the policymakers that matter, or is it the words of the researchers that matter, or is it the funders' words that matter in this program, in designing and implementing this program? So the rich picture in a way enabled co-creation. It is the communities, they are sharing their ideas, their knowledge. So we are using their knowledge to uplift their life. So it's a kind of co-creation there. That way, I think it is also kind of addressing this politics of knowledge, epistemic oppression, all that comes into picture. So that way, I think rich picture is an amazing tool if used appropriately. Of course, there are challenges with it. I'll stop
Yeah,
here.
we'll come to some of those challenges about who defines what the picture is and all of that in the next round. Matthew, do you want to talk a little bit about how you intended to use this, what was possible, and what value you think it added to the whole discourse around the national health insurance?
Sure. Yeah, so I think we were trying to use the tool to start a dialogue on how we can make the NHI work for everyone. It's been a very controversial topic, especially in the media. Health has been commodified, and so we're often only hearing from those who have a financial interests, like the private healthcare companies. And no one's really communicating on the complexity of the situation. And doesn't really make for good news to have a really complex dialogue about what's actually going on. There's a few people who are advocating for the people, but it's hardly ever the people themselves. So this was an attempt to try and engage people, get the understanding of what's actually going on, and also the possibility. That's why we chose to look at it from the future, looking back, what is actually possible? How could it be good and work for all of the people? And it's just a short example of how one can communicate policy ideas and their impacts to the public using storytelling and animation to reach people. I think these conversations often go over the general public's head. They're either too academic, or they're on policy which is being discussed in Parliament, and people feel like it's not about them. But actually, this NHI is about everybody. It's going to affect every single person in this country, and getting people to realize that, and to realize that they can be involved and have an impact on this discussion. I think that's really what we were aiming for. As I mentioned before, unfortunately with COVID, the public engagements which we were planning on doing couldn't take place. So we're trying to find a way to make sure that happens online. But now we also need to update the video, because I feel like there's a section missing. We're discussing, South Africa winning the 2019 Rugby World Cup. There needs to be and in 2020, the pandemic struck. But I really do think that this pandemic has really shone a light on these inequalities in our system between private healthcare and public healthcare. And now there is an opportunity to take that conversation forward and use this tool.
Yeah, and I think with COVID-19 and the increasingly remote sort of advocacy that one seems to be doing, the potential for using a short video that can be sent around on social media is also, I mean, it presents new possibilities, I suppose. I quite liked that there was this connection with popular historical events. I found that really nice because it helps you resonate with. I mean, I can imagine what it would have been if it was India, for instance. But I think that was a really nice touch. Fine. So a little bit more on reflection on the creation process, and I wanted to think a little bit more about what sort of ethical challenges do these things pose? And one of the reasons why I ask this also is because we've been in the many years of multimedia being part of this symposium and increasingly becoming part of health systems research, we still find that traditional IRBs and the way that we know how to do ethics in research struggles with how to assess um, a lot of interventions, but particularly multimedia knowledge creation through multimedia. And the questions that we are asking probably need to be quite different from what we are asking right now. So I wanted to also ask if you can reflect a little bit about what were the ethical problems that you anticipated and what showed up and how did you deal with them? Should we start with Leanne?
Sure. Yeah, Sana, as you point out, a lot of ethical issues in the making of this work aren't necessarily addressed by some of the ethics processes and some of the traditional boards that exist. And so I think a lot of it for me is relational, and it's the recognition that you're telling stories with a group of people. And so a lot of the ethical issues that arose along the way, for me at least, were about like constant iterations of the story to make sure that everybody who's part of the film feels like their story has been adequately represented and there's been enough opportunity to give input into it along the way. That I think is kind of one of the main ethical issues, at least that I kind of really tried to take on board. But it is an interesting point. I mean, at the institution where I'm based, all research was put on hold during the COVID pandemic, for example. And there's kind of, I guess, I was very safely moving around the city as part of my work, but the ethical board was kind of not really flexible enough to take sort of research issues or research imperatives into account during that time. So I think it's kind of, there are ways in which flexibility would be of huge value. And it's obviously, it's a question we ask over and over with the multimedia contributions to the symposium. And it's not an easy one, you know, because obviously these ethical principles are also very important to honor, but quite often I think they are more relational in this kind of work than they are in other sorts of traditional health systems research. And I think part of the challenge is a lot of IRBs are kind of coming from a very positivist or biomedical discipline, and so the sorts of ethical conundrums are quite different to the ethical questions we would ask ourselves in this work. The other big issue that arose was Rashanda Pascoe, who's in a witness protection program, and in fact is still. And we had a lot of conversations about her making this film and if it would in fact be safe for her to make the film. She was quite concerned about my safety in the making of the film as well. So we kind of had a lot of conversations about that. And in the end, for her, she felt that greater visibility, given that her kind of identity was known by this particular gang, for her, she felt that more visibility actually in some way made her safer. And so it's one of the reasons she chose to be part of this film project. So, I mean, yeah, let me stop there, but just to give a flavor of the kind of the diversity of the ethical issues that you take on board when you dive into this kind of work.
Yeah, absolutely. I can see the minefield there. Mimina, do you want to reflect a little bit? I know you spoke a little bit about it in your presentation, but I would imagine also that a lot of issues of equity would arise also, no, about who is driving the process of creation of the picture, and some of the conflicts that emerge, which are also, I mean, they can also serve as insights into community dynamics and so on. But how did you navigate that?
Interesting question, Sana. This is really challenging. As I said earlier, if you come together, a group of people come together and try to deliberate and try to put their ideas on the paper, definitely that there is that power dynamics within the team. To overcome this to an extent, we gave training to the people. We gave orientation about the development of rich picture and all that. But of course, training alone is not enough. To know more about it, we really have to collect more data to see if only a few people's ideas went into the picture development process or not. So that is definitely a challenge, but we try to have a facilitator, a neutral person to oversee that rich picture development process, and that kind of effort we did in this program. And the other important challenge what we faced in this program in the rich picture tool is that I said it was introduced in 2013. So as of now, we have more than 40 plus pictures as of now. So we try to, the academicians, researchers, we join hands with the practitioners of this program. And then we try to collate these pictures and try to publish this in the form of a book. So that's when we had a real challenge, we have to revisit these pictures which were drawn in 2013, 14. And this is a program, it's not like a research project where you have all documents collected and maintained in a systematic manner. So everything, even documentation, the program, it all evolved organically. So we have to figure out on the way how we have to do things, how we have to form coalitions, all that. So it was a bit challenging. So when we look back into those old pictures, as researchers, academicians, we don't want to interpret the meaning that was given by the people who developed those pictures. So that was real challenging. Who is claiming the ownership for this knowledge that is produced through the rich pictures? So that was real challenge. So what we did, we conducted a consultation workshop kind of thing, and we invited all the stakeholders who developed these pictures. The same people, when they visited the pictures they drew, some meaning distortion was there. It was there. So the time, the place, the context, even that matters, to really know what is the meaning of the pictures that were drawn by these people. So documentation is important. That's the important lesson we learned to overcome this challenge.
Yeah, that's very interesting. I think what we see at a certain time and what people who drew a certain picture thought about it is, I think that in itself provides a lot of insight into how our own understandings of our surroundings and our complexities change over time. So I'm sure because you had very often I think one of the problems is that you don't have this kind of long committed intervention to be able to understand some of these that dynamics. And I think that we try to make sense of drawings on walls from thousands of years ago, and how distorted must that be, and what insight do we have into some of these things, even if it's data about how people imagine their society and their systems. Matthew, do you have any similar reflections, particularly around this issue of collaboration? Because I think both Meena and you, and also Leanne, had a lot of different kinds of collaborations that you had to balance while creating this output. It was much more than the university or a research institution with a community. There seemed to be a lot of players. So do you want to say something about that?
Yeah, sure. I think Meena touched on it a little bit, which I think the biggest issue for me is always about the perspective. So as a person who's creating media and doing a lot of storytelling, you always have to decide whose lens are you telling the story through. You're always picking a perspective to tell that story from, and it can be very one-sided. You can end up telling a very skewed story. So yeah, with any media creation, you're choosing that viewpoint, and we didn't want to give a one-sided point of view, but at the same time, we still wanted to tell someone's story. We didn't want it to just be a random collection of facts, because that's having a story like that from a character allows you to see yourself in that character and actually get more meaning out of it. What was great with this particular project is that we had a whole team of writers who came together to create the story. So it wasn't just one person coming with their perspective. It was a group of people sitting down at a table over many evenings discussing the different aspects of the NHI which were important to them, things which they wanted to put in, and all having to kind of compromise and cut it down from this many-page document down to a short script, which was actually cohesive and understandable. But I think going through that process and hearing everybody's different perspectives around what they thought was most important actually gave us something which represented a broader perspective than just one person's point of view. And I think that collaborative process can be, as mentioned by the others, also really helpful in creating something which isn't one-sided.
Yeah, and I think this question of whose story is the true story, and do videos and films, etc., have the space to exhibit complexity? Sometimes I wonder if it's the other way around, that they actually do, because you have a process that requires many more people to participate in it, and just a sample size of 3,000 does not necessarily make something more representative or valid than a story that's told by, say, one person. So I think it's also about how you take that knowledge into account and what value you give it and how you use it. So in that sense, I think there is some potential in also challenging that assumption that multimedia is inherently biased, because we've heard that as well. That there is how do you know what other people's experiences are? That's not the point. It's about how you're using this and what it's saying to you. I also I mean, there are I want to open up for questions, but I think please do ask questions alongside. We have about 15 minutes more, so we can take more questions if the attendees have more questions. So please type them into the chat box and we will present them to the panelists. But meanwhile, I also wanted our panelists to perhaps talk a little bit more about what kind of possibilities do you see as filmmakers and as practitioners of multimedia for this field going forward, and what is it that what opportunities do you think this post-COVID era, if at all, or challenges it holds for the field of multimedia? Should we start with Matthew this time, or anyone
Sure.
else? That's fine.
Yeah, no, I'm happy to go. So yeah, obviously as a content creator, I'm seeing lots of opportunity during this time for the creation of new media, because that's a great way of reaching people when we can't necessarily get together and have a conference. We find ways and means to connect with people. And I think you touched on it just now after I spoke. It also offers an opportunity to challenge people with different perspectives. We were talking about choosing a perspective for a particular piece of media, but you're also having an opportunity to challenge people's perspectives by giving them a new story, a new piece of information that they might not have heard, or somebody else's perspective that they might not have considered. So I think there is a lot of opportunity now in this new changing world, in this new era, especially using media and technology to connect with people, inform them, and also challenge their perspectives.
Meena, do you want to reflect on this also, because your work is in a very different space? It's grassroots work in that sense.
Yeah. So I have a different take on this, in the sense we all talk about, this COVID has connected many people through technology. Now we are able to have more people in the conference, more people in the discussions. So I'm skeptical about that because still, especially coming from India, I can see the huge digital divide that is there between the urban and the rural counterparts. Still many people are there without access to internet, without access to technology. And I think this COVID has made situations worse, especially for social movements, building coalitions, especially at the grassroots level. If you see, for the instance, the example of what we took, the basic healthcare support program, where the network of NGOs. So this kind of rich picture development and all cannot be done in that through technology. It is not that effective. And because we are the kind of people we are dealing with is different. So the media format, the communication format need to be adapted according to the stakeholder and the issue we deal with. That's very important. We should be cautious, and the post-COVID era is not very promising for the social movement per se. So we got to be really creative, and we got to be, and there is every opportunity to suppress this kind of dissent, or in the name of curbing the pandemic, that autonomy to express your ideas is definitely happening. We are seeing that. So we should not allow that. We got to be really creative and to overcome this challenge.
Yeah, thank you for that very sobering and grounded perspective. I think also what happens is that people who have access to the internet and to technology and to networks more than anything else are the ones who are producing information. So there's of course the fake news pandemic and all of that happening alongside as well, and that should not be underestimated in any way. And I don't think we can compete with it. Like if we think that we can produce alternate information that will be more popular than the fake news, that probably won't happen, because that's just the nature of fake news. But I think there is definitely something to be said about the need for more equity in access to technology and access to media for people who are able to view grassroots reality in the way that those of us from afar cannot. The micro reporter, the person who's hyper local, who can make videos on their phones, etc., of violations which are also taking place. And I think that those sort of things are probably people don't invest in that so much, and it's usually something that you see on Twitter or something like that. But I think there is something there for us to make use of also, while keeping in mind the fact that we have to meet. We can't organize without meeting at all. Yeah, Leanne, do you want to say last words, and then we have to wrap up in the next 5 minutes?
Sure. Yeah, I mean, I absolutely agree. I mean, that digital divide certainly resonates with the experiences here in South Africa as well. And you do have to take it very seriously. I mean, previously we had sometimes we talk about Cape Town as a city of islands because of how the spatial divides put in place by the apartheid system still exist so significantly. And now that looks different during times of COVID, and you have to be very creative about how you directly tackle those digital divides. But when you do, I think it does also open up possibilities, which kind of links to what you were saying, Matt, but you have to take it seriously. It doesn't just happen on its own, I also think that's one of the things that is really, really important to still be fighting for quite actively is how multiple different forms of evidence are in fact legitimate in this kind of post-truth world in which we're living. And even before this pandemic, there were very sort of hegemonic ideas about the world in which we live, and the systems that are shaped by these ideas are very resistant to change unless we start to change how we think about our world. And so I do think, I haven't quite given up yet, Sana. I do think there are some ways in which introducing counter narratives are really, really important, although I'm under no illusion that we can take on the machinery that shapes the digital world. But I do think those counter narratives are still really, really important. And I think that for us, sort of working in this field of multimedia and thinking through what contribution it can make in HPSR, these are quite important questions to continue to grapple with, because I think what we've seen in the past is quite an instrumental use of multimedia. So it's either been used to educate people, or it's been used to advertise a PEPFAR program. And there's not a lot of work that is critical. And I think the three pieces on this panel are a great example of how to be much more critical in bringing multimedia into the research process. And I think there's not enough of that work for reasons we all understand. So I think that there are possibilities, and that in some ways, as we keep talking about now more than ever, they really matter, because we face very, very uncertain times, and it really is going to take all of us to it's an all hands on deck moment to sort of figure out how we can reshape things moving forward.
Yeah, thanks for that, Leanne. So we have to wrap up really quick, just to let our attendees know there are 3 more panels in the multimedia track, which will continue these conversations, and we hope that you'd be able to join us for those as well. The next one is on the 10th of February at 5 p.m., which is knowledge co-production for better health and social justice in health systems. Then we have one on the 10th of March, also at 5 p.m., which is disrupting power and knowledge hierarchies, shifting the biography and geography of evidence. And finally, we have one on the 24th of February at 7, which is on reimagining health systems for a more socially and ecologically just world. Thanks so much for attending this, and we hope to keep engaging with you in the future. Thank you for your appreciation and for your suggestions. We look forward to seeing you at other sessions as well. Thank you so much.
I would like to thank everyone for participating, and I hope you all had a good time. So I'm your host, Elise, and I will be ending this session now. Thank you, and I hope you all have a good